Autumn has arrived, and for millions, 'tis the season for sniffling and sneezing. But is it allergies or sinusitis? Dr. Josh Meier is a fellowship-trained rhinologist with the Nevada ENT and the Reno Tahoe Sinus Center. You must be busy this time of year.
Yeah, it's a busy time of year. In Nevada, we have two real strong allergy seasons: in the spring with the trees blooming, and then in the fall with the weeds, which include rabbitbrush and sagebrush, which is currently going on right now. So
how do you know the difference if it is allergies or sinusitis?
So chronic sinusitis is usually months of symptoms that don't really have a seasonal variation, which includes nasal obstruction, drainage, smell loss, facial pain, and discomfort. Allergies are usually just nasal obstruction, drainage, and could be some smell loss. So things can overlap. People can have allergies and chronic sinusitis. People can have chronic sinusitis without allergies, but it is kind of determined on a patient-by-patient basis.
And if we're talking chronic, that's 2-3 months without relief.
Our Academy of Otolaryngology defines chronic sinusitis as 3 months of symptoms consistently.
How do you treat it?
So fortunately, both are treated very similarly. The first step is using a topical nasal steroid spray like fluticasone or Flonase, and then nasal saline rinse, which you can buy over the counter.
Yeah, a lot of people use that this time of year. How soon can someone experience relief if they start that type of regimen?
So it usually takes about a week or two. So the nasal steroid sprays take about a week to see an effect. You have to use them consistently. To see an effect, you can't use them one day and expect to see some relief. You have to use them like every day for a couple weeks there.
And we've done some stories with you in the past. At what point is surgery an option?
So surgery for chronic sinusitis is an option for a patient when they failed appropriate medical management, which is usually some combination of steroid sprays, saline rinses, oral steroids, and sometimes oral antibiotics. So it's determined on a patient-by-patient basis. There's rarely any absolute indications, but mostly it's a relationship with the patient, and they end up making that decision themselves.
Would a humidifier help?
It can help with just rhinitis, which is very common in Reno as well because it's so dry and dusty here. So yeah, that can help. It helps with nosebleeds for sure, but it can help some of the pressure symptoms that people experience as well.
And very common in this climate.
Very much so.
Okay, thank you so much. Dr. Meier will be here until 6 o'clock tonight if you have questions. Call 858.